Pain in your lower back, burning down your leg? It might be sciatica. Dr. Michael Gilbert, owner of Gilbert Physical Therapy, is here on today's show with the top 10 most burning questions for sciatica. But I want to start with my top two questions, which is just, what is sciatica? What causes it?
Sure. So sciatica is a common thing that we will treat, and a lot of people will deal with this. And it's an all-encompassing term to mean any kind of pain that would refer down the leg. So there are a number of different causes for this, one of which would come from a herniated disc in the back. And on our spine model, there's a little illustration of it in red here. A herniated disc is when the material pushes out and it pushes onto one of the nerves that would go down the leg, hence why the pain goes down the leg. Another factor could be involving the sacroiliac joint, which is where the pelvic bone meets the spine itself. That can also refer pain down the leg. You may have someone who has stenosis of the spine, which is where two of the vertebrae will come together. It also pinches one of the nerves that would go down the leg, and that's why the burning occurs, and it's usually a commonly misunderstood type condition.
Yeah, that's understandable because you're feeling the pain in your leg. You don't think maybe it's your back too.
Sure.
So let's get into some of those really top 10 burning questions. Number one, big one, how long does it take to go away?
Right, so it varies for everybody. Generally speaking, in the body, it takes about 4 to 8 weeks for something to change. So basic physiology and biology creates a pattern in the body of 6 to 8 week cycles of improvement. If you are younger, have good diet, activity levels, these are all things that are going to influence whether you heal faster or slower. And in some cases, it'll take up to 1 to 4 months for a full return of function.
Very good. Another question, how would somebody benefit from physical therapy? How long before they should seek physical therapy?
Sure, so someone might have relief with physical therapy within the first 1 to 3 visits. Usually someone is going to have relief within 1 to 2 weeks, and it will depend in somewhat on what type of condition it is. And if it's not improving in that amount of time, it may be a different cause of sciatica than what they think. And that, despite what might happen on an X-ray or an MRI, 65% of the population will have an abnormal X-ray or MRI, but not have the symptoms correlating with that.
Oh, interesting. Okay. Top question number 3, another big one. Can I be completely healed from this, or is this going to linger for a long, like forever?
So the answer is yes. And there are 3 phases of healing that most people are going to go through. One is an acute phase, and generally speaking, when we see someone in the acute phase, we're working on pain control, using different hands-on techniques, trying to modulate that pain. Then there's an impairment phase where we're working on flexibility, strength, trying to build that person's body up. And stage 3 usually ends up being a return to work or a sporting activity where we're working on lifting, standing, things like that.
Very good. Okay, now as you know, these segments we do, they go so fast,
Right.
no way we can get to all 10 questions. So how can viewers get the answers to the top 10 burning questions?
Sure, so we did the top 3 of the 10.
Right.
If you want the other 10, what you can do is call our office and request the free report. And it is a free report on the top 10 most burning questions for sciatica. And as a special bonus, the first 10 callers who call in for that, we will offer a free screen to them for their pain.
Very good.
Now the qualifications for this are you have to have insurance and back pain or leg pain within the past 60 to 90 days.
Very good. And if somebody does make that appointment for a free screen, where are you located?
So we are on the Carlisle Pike in Mechanicsburg.
Very good. Very convenient. Good to have you always, Dr. Gilbert. Thanks for easing our pain month after month. You're a great help to our audience.
Very good. Thank you.